If we follow the IRMA 2017 regulations, each patient of childbearing age, regardless of presenting gender, should be asked if they have reproductive organs, and then further inquiries about their pregnancy status are made. Here are some top tips to take away, which were taken from a guest editorial in Radiography, also linked to in the further reading list. Make no assumptions about a patient's biology, gender identity, or sex based on their appearance alone. Listen and believe transgender and non-binary people when they tell you that they are transgender or non-binary. The standard 3-point identification check will always make you aware that your patient is the correct patient. Review forms, documentation, and clinical templates. Does anything need changing to make these more appropriate for transgender or non-binary people? Does the information provided for your patient reflect their wishes? Do you or your colleagues need some further training? There are organisations which provide specific training on working with trans and non-binary people.
So to make a trans patient feel more at ease when they're coming for their imaging examination, you can do different things. One thing while the patient's actually there, speaking to them, sort of away from the main waiting area, so you're in more of a private situation, asking them what pronouns they prefer, and make sure that you then refer to them with the correct pronoun for the rest of the examination. I think staff members actually understanding different terminology and things is really important. It's sort of a relatively new thing that we're coming across in departments now. So a lot of staff are not sure on kind of the different terminology and how to address trans patients. So just getting that knowledge in the background is really good and good practice. And also things that you can think about, that you can do for the whole department is looking at the paperwork that you have. You could look at using more kind of inclusive language on your paperwork, pregnancy forms, the MRI safety forms, CT safety forms, and things like that.